Hello, everyone, and welcome to Doc Fat's channel. Here we break down the latest evidence-based sports medicine topics. We just get tons of questions about acute respiratory infections, ARIs, especially from athletes, parents, coaches, really anyone involved in sports.
Yeah, it's a pretty common concern. I mean, you see these athletes, they look so fit and healthy.
Right, you'd think they'd have superhuman immune systems,
Mhm.
but then they get sidelined by a cold, and everyone's wondering what happened.
Exactly. And the research actually shows that over half of all the medical consultations at major sporting events are due to ARIs. It just goes to show these infections are really common, even among athletes in peak physical condition.
Wow, that's surprising.
Yeah.
So, what causes these ARIs in athletes? Is it all the close contact and shared equipment?
Well, the research points to viruses as the main culprit. Think about it. The close contact in sports, sharing water bottles, touching the same equipment, travel schedules disrupting sleep. It's kind of a breeding ground for viruses.
All right. So we're talking about things like the flu, common colds, maybe even COVID-19.
Exactly. And the tricky part is, you can't always tell which virus is causing the problem, just by looking at the symptoms. Sometimes you need lab tests to get a definitive diagnosis.
That makes sense, especially since these ARIs can show up in different ways.
Mm-hmm.
The research talks about something called syndromes. Can you explain what those are?
Yeah. Syndromes are basically ways to categorize ARIs based on where the infection is. Like, is it in the nose, the throat, the lungs, and also how severe the symptoms are.
Okay, so you've got everything from a runny nose
Hmm.
to something more serious like bronchitis
Mm.
or even pneumonia.
Exactly.
So how can you tell when it's just a sniffle or
Right.
something more serious?
Well, that's where understanding these syndromes comes in handy. Like if an athlete has a mild cough and a runny nose, they might be okay with rest and fluids.
Right.
But if they have a persistent fever, difficulty breathing,
Hmm.
or chest pain, they need to see a doctor right away.
That's good advice, especially when there's a big game coming up and the pressure's on to play. Speaking of performance, how much do these ARIs actually affect athletes? Can a simple cold really sideline a seasoned pro?
Well, the good news is most ARIs in athletes are mild, and they clear up without any long-term problems. But even a mild ARI can impact an athlete's performance. And if the infection is more severe, it can lead to complications during exercise, increase the risk of pneumonia, things like that.
So it sounds like even a minor ARI shouldn't be taken lightly. This makes me think about return to sport decisions. How do doctors determine when an athlete is really ready to get back in the game?
That's a tricky one. There's no one-size-fits-all answer, but the research suggests a stepwise approach. You have to consider the severity of the infection and the athlete's individual risk factors.
It's not just about waiting for the fever to break.
Not necessarily. Doctors often use checklists to guide these decisions. They look at things like resting heart rate, breathing, body temperature, and they check for lingering symptoms like fatigue or muscle aches.
Sounds pretty
It is. And in some cases, they'll also use an exercise challenge test where the athlete performs specific exercises while their heart rate, breathing, and other vitals are monitored.
So this helps determine if their body can handle the exertion.
Exactly. It gives doctors a clearer picture of how well the athlete is recovering and if there are any lingering effects from the ARI.
It sounds like open communication is really important here between the athlete, their coach, and the medical team.
Absolutely. It's a team effort. Everyone needs to be on the same page and prioritize the athlete's long-term health.
This has been really eye-opening. We've learned that ARIs are incredibly common in athletes, even at the elite level, and their impact can range from minor inconveniences to more serious health concerns.
Right. And it's important to remember every athlete is different, so their recovery will vary.
Absolutely. But before we move on to prevention strategies, there's something in the research that really caught my eye. The potential overlap between concussion symptoms and ARI.
Oh, yeah. That's a really important point because some concussion symptoms, like headache, fatigue, difficulty concentrating, can actually look like an ARI.
So there's a risk of misdiagnosis.
Exactly. That's why doctors need to be really thorough. They have to consider the athlete's history, their symptoms, and any potential head injuries.
This just shows how complex it can be to diagnose and manage athlete health.
You're absolutely right. There are so many factors to consider. It requires a really holistic approach.
Well, this deep dive has given us a lot to think about. But for now, let's take a quick break. And when we come back, we'll dive into some strategies for preventing those pesky ARIs in the first place. Stay tuned. Welcome back, everyone. Now that we know how much these ARIs can impact athletes, let's talk about prevention. What can athletes, coaches, and parents do to stay healthy?
Well, the research actually offers some good strategies, and probably the most basic one, but also the easiest to forget sometimes, is good hygiene.
You mean like washing your hands and stuff?
Exactly. Hand washing, avoiding close contact with sick teammates. It sounds simple, but it makes a huge difference.
I can imagine it's tough, though,
Hmm.
especially in team sports where there's so much contact.
It is, but there are things teams can do, like encouraging frequent hand washing, having hand sanitizer available, disinfecting equipment regularly. It all helps.
Right, so it's about creating a culture of hygiene.
Exactly. And then, of course, there's vaccination.
Yeah, vaccination is always a big topic.
Hmm.
But the research is pretty clear. Vaccines are effective at preventing some of these infections.
They are, especially for athletes competing at a high level. Staying up to date on vaccinations can be a game changer.
It helps protect them from the more serious infections.
Exactly.
Okay, so we've got hygiene and vaccination. What else can athletes do?
Well, the research also talks about lifestyle factors, things like getting enough sleep, managing stress, eating a balanced diet,
The usual suspects.
right? But they're so important. They all contribute to a healthy immune system.
So it's not just about physical training, it's
Mhm.
about overall health.
Exactly. And speaking of overall health, one area that's getting a lot of attention is the gut microbiome.
The what?
The gut microbiome.
Remind me what that is again.
It's all the bacteria that live in our intestines.
Oh, right. And what does that have to do with ARIs?
Well, research is suggesting that a healthy gut microbiome is important for a strong immune response. And there's some evidence that probiotics might help, those things that introduce good bacteria into the gut.
Probiotics.
Yeah. They might actually help reduce the severity and duration of those upper respiratory infections.
So eating yogurt or taking a probiotic supplement could help athletes stay healthy.
It's possible. More research is needed to be sure, but it's definitely an area worth exploring.
It's amazing how everything in the body is connected.
It is.
Well-
What happens when an athlete does get sick, despite their best efforts? How do they know when it's safe to return to training?
That's a good question. Because I know there's always that pressure to get back in the game.
There is. But pushing too hard too soon can actually make things worse.
So what's the best approach?
Well, the research says each case is unique. But for mild cases, athletes can usually return to activity gradually once their symptoms are gone. But it's crucial to listen to their bodies and not overdo it.
So no playing through the pain.
Exactly. Rest is essential. For more severe cases, though, or for athletes with underlying health conditions, they really need a doctor's clearance.
Okay.
And the doctor will probably recommend a structured return to sport program with close monitoring.
What kind of monitoring?
They'll check things like resting heart rate, breathing, body temperature, and look for any lingering symptoms like fatigue or muscle aches.
Makes sense.
They might even do those exercise challenge tests again to see how the athlete's body is handling the exertion.
So it's a pretty thorough process.
It is. The goal is to make sure that the athlete is truly ready to go back to their sport.
And again, communication is key.
Absolutely. Athletes need to be honest with their coaches and medical team about how they're feeling. And coaches need to put the athlete's long-term health first.
It's a team effort.
It is.
Now, we've talked a lot about the physical side of things. But what about the mental aspect? Getting sick can be tough for athletes mentally.
It can. They might feel frustrated, anxious, even guilty about missing training.
Right. So how can they stay mentally strong during recovery?
Well, it's important to remember that getting sick is normal. It happens to everyone, even elite athletes. It's not a sign of weakness.
Okay.
And they should focus on what they can control, like their attitude, their effort in following their doctor's recommendations, and their commitment to recovery.
So finding ways to stay positive.
Exactly. And they can use the time to focus on other aspects of their training, like mental imagery, flexibility, strength training, if that's allowed.
So staying engaged even when they're sidelined.
Exactly. And it's important to seek support if they need it, from their coaches, teammates, or even a mental health professional.
There's no shame in asking for help.
None at all. Now, before we move on, I want to mention a few special considerations that came up in the research, like athletes who travel a lot, especially internationally. They face some unique challenges when it comes to preventing ARIs.
How so?
Well, travel can disrupt sleep schedules, expose them to new environments and pathogens, and create stress, all of which can weaken the immune system.
So those frequent flyer miles can have a downside.
They can. But there are things athletes can do, like being extra careful about hand hygiene, staying up to date on vaccinations, and trying to maintain a regular sleep schedule.
So being proactive.
Exactly. And if they do get sick while traveling, it's important to see a doctor right away.
Don't try to tuck it out.
Right.
Now, what about athletes who get ARIs all the time? Is there anything they can do?
Well, in those cases, it's important to figure out why they're getting sick so often. It could be something simple, like not getting enough sleep, or a nutritional deficiency, or it could be something more complex, like an underlying medical condition.
So they need a thorough evaluation.
Exactly. Once they know what the triggers are, they can work with their doctor or a dietitian to come up with a plan to support their immune system.
So it's about personalized prevention.
Exactly. And that might involve things like improving sleep habits, addressing nutritional deficiencies, or managing stress better.
This has been so informative. We've learned that preventing ARIs is about more than just avoiding germs.
It is.
It's about taking a holistic approach.
Absolutely.
It's about hygiene, vaccination, sleep, nutrition, stress management, even gut health.
And it's about everyone working together, athletes, coaches, parents, medical professionals. We all have a role to play.
It really is a team effort.
It is. Now, before we wrap up this episode, I want to circle back to something we mentioned earlier, that overlap between concussion symptoms and ARIs.
Right, because misdiagnosis can be a real problem.
It can. So doctors need to be really careful. They need to ask detailed questions about the symptoms, when they started, how long they've lasted. And if there's any chance of a concussion, they need to keep the athlete out of play until they can do a full evaluation.
Better safe than sorry.
Exactly. And there are some specific tests they can do to help diagnose a concussion, like tests for balance, coordination, cognitive function.
And these tests can help tell the difference between a concussion and an ARI.
They can. They provide more information to help with the diagnosis.
So if a concussion is diagnosed, the return to sport process is different than for an ARI.
It is. With an ARI, the focus is on physical recovery. But with a concussion, there is also the cognitive side of things.
So it's not just about waiting for the physical symptoms to go away.
No. Athletes have to gradually increase their activity, both physical and cognitive. And they have to be monitored closely to make sure their symptoms aren't getting worse.
So it's a much more cautious process.
It is. Concussions are serious injuries.
Yeah.
And we need to protect the athlete's brain.
This whole discussion about concussions has really added another layer to our understanding of ARIs in athletes.
It has.
It shows how important it is to have thorough evaluations,
Yeah.
accurate diagnoses, and appropriate return to sport plans.
And it highlights the importance of collaboration between healthcare professionals, coaches, and athletes.
Now, as we wrap up this deep dive, I want to leave our listeners with a question. We've talked about viruses causing ARIs, but what about the role of the environment?
That's a great question, and one that we'll explore in part 3 of our deep dive.
Stay tuned, everyone.
Welcome back. We're going to talk about the environment and how it can affect an athlete's risk of getting sick.
This is interesting. We've covered viruses and hygiene and lifestyle choices, but the environment, that's something you can't always control.
Right, but knowing the risks can help athletes make smart decisions.
So let's start with air quality. Does breathing in polluted air make athletes more likely to get ARIs?
It seems like it does. Studies show that high levels of air pollution, especially those tiny particles you can't even see, they irritate the lungs, cause inflammation in the airways.
So it's not just about smog looking bad. It's actually making the respiratory system more vulnerable.
Exactly. And for athletes who are pushing their lungs all the time, that inflammation can make them more susceptible to infections.
That makes sense. What can athletes do about it, especially those who train in cities with bad air quality?
Well, they can try to train when pollution levels are lower, like early morning or late evening.
So checking the air quality forecast.
Yeah. And if they have to train during peak pollution times, they can wear a mask, one that filters out those tiny particles.
Like those N95 masks.
Exactly.
Okay. What about altitude? A lot of athletes train at high altitudes to improve their endurance. But doesn't that also suppress the immune system?
It can. Research suggests that being at high altitudes can temporarily weaken the immune system, making athletes more vulnerable to infections.
So it's a trade-off.
Kind of. You get the benefits of altitude training, but you also increase your risk of getting sick.
What can athletes do to minimize that risk?
The key is to acclimatize gradually. Don't just fly in and expect your body to adjust right away. Take it slow. Give your body time to get used to the thinner air.
So don't push it too hard too soon.
Right. And also, stay hydrated. Get enough rest. And keep up those good hygiene
But
habits.
those basics become even more important at altitude.
Absolutely. Now let's switch gears again. Back to the gut microbiome.
Okay, we talked about probiotics.
Hmm.
Is there anything else athletes can do to support their gut health?
A balanced diet is crucial. Lots of fiber. From fruits, vegetables, whole grains. That helps nourish the good bacteria in the gut.
So all those healthy eating recommendations.
They really do matter. And there's also some research on certain supplements,
Whoa.
like vitamin D. Studies have shown that vitamin D supplements may reduce the risk of upper respiratory infections,
So getting some sun.
or taking a supplement might help. And there's some evidence for zinc, too. It might help shorten the duration of ARI symptoms.
Is a good diet. Plus maybe some supplements.
It could give athletes an extra boost to their immune system. But of course, always talk to a doctor before starting any new supplements.
This has been a really fascinating deep dive. We've learned that preventing and managing ARIs in athletes is a complex process.
It is.
It's not just about one thing.
Right.
It's about a holistic approach, considering everything from the air athletes breathe to the bacteria in their gut, and it's about everyone working together. Athletes, coaches, parents, healthcare professionals.
Absolutely.
It's about creating an environment that supports health and performance.
Exactly.
And it's about staying up to date on the latest research.
That's key.
Well, I hope our listeners feel empowered to take those proactive steps to prevent and manage ARIs.
Remember, knowledge is power when it comes to athlete health.
If you have any questions or topics you'd like us to cover in future deep dives, please let us know.
Stay curious, stay informed, and stay healthy.
Until next time, everyone.